All right, seems we are live. Good morning, everyone. On behalf of Zong, I am delighted to welcome you all to our Inktober Breast Cancer Awareness webinar, hosted in collaboration with our guests, Pink Detect and CxO Global. Pink Detect is an AI-driven health tech platform transforming how we approach early detection and women's health. Every October, the world turns pink, and for good reason. Breast cancer remains the most common cancer among women worldwide. In Pakistan, 1 in every 9 women is at risk, one of the highest rates in Asia. The real challenge often isn't awareness, but ensuring access to timely care and creating space for health in our daily lives. Early detection can make all the difference, improving treatment options, survival outcomes, and overall quality of life. When detected early, breast cancer is up to 90% treatable. This session is our way of bridging that gap by using technology, credible information, and expert guidance to help turn awareness into life-saving action. On behalf of Zong, we thank you for joining this important conversation because awareness inspires action and action saves life. To start, let me briefly introduce our partners and the incredible panel joining us today. Pink Detect, our knowledge partner, is a pioneering AI-driven health technology platform working to make early detection accessible for all women. We're privileged to be joined by 3 remarkable experts from Pink Detect, each bringing global experience in medicine, research, and innovation. First of all, I would like to introduce Ms. Suha Lalani, founder and CEO of Pink Detect. Thank you so much, Suha, for joining us. She is the CEO of Pink Detect, an AI-driven health tech platform, as I mentioned. She is pursuing her Masters of Public Health at Harvard University currently, focusing on integrating AI intelligence into healthcare to improve outcomes and success. Ms. Solmaz Ebrahimi-Iranpour, the Chief Research Officer at Pink Detect. Thank you so much for joining us. She holds a Master's in Molecular Biology from Canada and is an inspiring oncologist. She oversees all scientific content and research at Pink Detect, ensuring the medical accuracy and integrity of its awareness programs. And then lastly, Ms. Shaikh, medical advisor at Pink Detect. Thank you, Sana, for joining us. Sana is the Associate Director of Infection Prevention and Control at Runnymede Healthcare Center in Toronto with a Master of Public Health from Queen's University. Thank you all so much for joining us today, and we look forward to hearing your expert insights. Please join me in welcoming all of you today. And Soha, I'll hand the stage over to you, and you can take over. Thank you so much.
Thank you so much, Ramesh. That was a very kind introduction. So without further ado, hi, everyone. It is such an honor to be here today. And before my team can get started with our intros, I just wanted to take a very quick moment to thank Zong and their CSR arm for inviting us for, such a meaningful step to support Pinktober. It's especially heartwarming when you see Pakistani organizations using their platform to raise awareness for such an important cause. So, without further ado, my name is Suha Lalani, and I am the founder of Pink Detect, which is, like Ramesh mentioned, a social enterprise that aims to promote early breast cancer detection and reduce breast cancer mortality by blending the power of technology and grassroots action. Now, this mission did not come to us overnight. It has been deeply rooted in our own journeys. And even growing up, Solmaz and I saw how, many women, even in our privileged circles, lack the awareness around this topic. And that is one of the reasons why I started a degree in biomedical sciences, and now I'm doing a master's in public health. Um, Even before I started my master's, I was working at a tech company in Canada, and I witnessed firsthand, how innovation, especially technological innovation, was revolutionizing healthcare, improving access, accuracy, and outcomes. And it was particularly during that time that I realized, how powerful technology could be used in addressing some of the most pressing challenges in health, and breast cancer being one of them. So that experience ultimately inspired me to create Ping Detect. And I just hope that today's session is all about awareness and empowerment through knowledge for you all. We'll talk about the small steps that each of us can take here today that can make a life-changing, difference for ourselves, our families, and our communities. And I promise I'm going to stop rambling, but my only ask here for you all today is to engage, ask questions, and take away at least one action point that you can, take forward with you after today. And with that, I think I can pass it over to Sana.
Thank you, Suha. Thank you, everyone, today for joining us. So, as Ramis introduced, my name is Sana Shaikh. Please bear with my voice. It's just the flu season going on over here, and it might just crackle in between, but I'll try to come up over in the best way possible. My name is Sana Shaikh, and I have a background in Masters of Public Health, and I have a privilege to work with infection prevention and public health in many domains, which allows me to see social health and all the sectors with a very close eye. And I'm equally privileged and honored to talk with our audience today over here. Without wasting much time, I would say I will just share screen, and I would ask Suha to help me if you all can see the screen and our slides so that we can go forward with the presentation.
Sounds good. Let's do it.
Is
I
it
can see the screen, yeah.
perfect? Am I audible and everything is good?
Yeah.
Perfect. Sounds good. Then I'll just get started. So we are gathered here today for the breast cancer awareness, since Pinktober is something, as Ramis mentioned, for all the good reasons. And we are here to tell you how Pink Detect can help you for being your best breast health ally. What is our goal today? It's very simple. We are here to talk about the early detection of breast cancer. We are here to tell you what are the red flags and early signs and symptoms. We are also here to talk on some of the numbers and stats that we have gathered so far based on the breast cancer and what is the mortality rate of breast cancer in Pakistan right now. We're going to also talk about some of the challenges with early detection, and we are going to get through with our app, and we are going to show you all the features that the app has for you, which will help you with the early detection of breast cancer. So why are we talking about this? One might wonder why this conversation is so important that the whole month is targeted for just this talk and just this topic. Why it is so important? So if we see that 50% of women ignore their breast health due to their busy lifestyles, and they feel like that there is no need of a breast routine examination, it constitutes almost 18% of women. If we go for the 2% of the other women, they feel shy or they feel uncomfortable to perform a self-exam. And that exactly goes where all across the social globe, Pakistan has almost 24% of annual cancer rates. When you'll follow along with the numbers, we can see that roughly 178,000 women in Pakistan suffer from breast cancer at some stage of their life. And that is a huge number. If we see it closely, 1 in 9 new cases of breast cancer are reported each year in Pakistan. That takes Pakistan to the highest breast cancer mortality rate all across the South Asian countries. And the rate is 23%, which is quite alarming. That makes it 50% of deaths annually due to breast cancer only. Now, how can we reduce the numbers? If we look at the root cause of it, it is lack of early detection. And we talk about lack of early detection. There are so many root causes to it, why there is delay in early detection. If we see here a bit more closely, about a quarter, it's something that is constituting just the breast cancer. Breast cancer is something which is not talked enough, although it's affecting more than enough to talk for us, because it might be considered a taboo. It might be considered that it's too cliche, or maybe it's a very shy topic to speak on. But the numbers, they do speak very high for themselves, very high for us to get inspired and to actually put our steps into early detection. Even if one of our audience is inspired today from the webinar, from the information that we are sharing today, and get checked, or motivate others around them to get checked, that can significantly reduce the numbers over time. I think this webinar would be more than successful. This talk, this sharing of thoughts that we will be doing today will be more than successful. If I dive deep into this one, what is the importance of early detection? We have divided it into three parts for you to understand it better. So if we go as part of treatment option, if the breast cancer is detected early, we are looking at the minimally invasive surgeries or minimally invasive treatments. So that could just be, for an example, removal of just the tumor rather than the entire breast. Versus if we are looking at the aggressive treatments, which is the late stage of the breast cancer, we are looking at the high-level chemotherapies, radiotherapy sessions, and also the invasive surgeries, which do involve the entire breast removals or maybe a part of breast removal. If we go and talk about the survival rates, I always say this, that it's an extremely good news. I do understand that how heavy detection of cancer or could be. But still, if we look at the medical point of view, I always say that this is a great news, that the early detection, the survival rates are over to 90%, which is a huge, huge number and such a hopeful thing to look around with. Whereas the advanced breast cancer survival rates are merely 27%, depending on what kind of stage they are being diagnosed at. If we come to the treatment cost and the accessibility of the healthcare or the treatments, if we go on the preventive and early treatments, then the treatments are less costly, they are more accessible. And if we go to the advanced treatments, which is coming again for the late detection, they can definitely be more costly. And accessibility can vary based on the demographics and based on any country, based on the country's medical system. So that can vary too. Let's talk about some of the challenges. Now, these are the 4 challenges that you can see on the screen, just not merely the words, but these are some things which we will see in more depth in the next slide. So I think the 4 of the major challenges that one would, or we have seen so far in early breast cancer detection is gender-based violence, limited access to healthcare services, less awareness, cultural norms, and social fears. Now, what are they? Like, what are those big words? How they look like once they are happening in our society? If we look at the gender-based violence, that means the fear and trauma of abuse, any economic dependence of women on their limiting healthcare choices, any restricted autonomy in making any decision, and that decision could be anything, going for a mammogram, taking a step to go out to get the breast health checkups, social isolation and lack of support, which most of women feel in our society, mental health consequences of the violence. When we talk about the less access, we talk about geographic and transportation barriers. Can they reach to the clinics? Limited or delayed screening or diagnosis programs, and inadequate physical, mental, and emotional support services, which if they are going through any such kind of healthcare issues, they can access to. Another one is less awareness, which means limited understanding of risk factors of early signs, limited understanding of what is the prevalence, what is the myth, what is the misinformation, lack of breast health education in schools, and need for more inclusive and multilingual awareness camps. If one cannot reach the words in English, there should be more languages that are more commonly spoken in Pakistan and more accessible. And the 4th one is social norms, which means actual cultural acceptance of silence around women's health, fear of diagnosis and social stigma, reliance on traditional remedies over the medical care, and privacy and modesty concerns, which are preventing the early checkups. Now, what to look for? What are the red flags when you are self-examining yourself? So any increase in size, any change in the shape of the breasts or nipples, any turning inwards or any nipple inversion, any discharge other than breast milk, any dimpling over the breast surface, any general pain which is not part and you feel like that this is a pain which is not a usual thing, any breast lump, any thickening, any swelling, anything under the areas of your lymph nodes too, any redness or pitting of the breast skin. These all are something which are the red flags, which should be the alert signs for you once you are examining the breast. Now, mammogram, a word which is very common but not much used, I would say, in its right way. So it's a golden standard for screening. Why is the mammogram so essential? It helps us spread awareness about mammograms. So if we go, especially women over 50 who are at a higher risk of developing breast cancer, if the regular mammogram screenings are done in right way, they can detect cancers early, and it's most treatable and have the highest rates of survival overall. If your self-exam or family history indicates that there is a higher risk, you can talk to your doctor about starting the screening at a bit younger age, and they can guide you how frequently can you do the screening based on your family history or maybe any other genetic issue which can lead towards the cancers. A bit of a prep guide for mammogram that we want to go through. Let's say if somebody is going for a mammogram, what three things or what major things that we can look upon is one, that you should schedule always smartly. That means you have to plan your mammogram when your breasts are not tender or swollen. And that is typically around the time once you are done with your menstrual cycle or after 1 week of your menstrual cycle. And this is more comfortable and accurate screening timing, which is considered for mammogram. Whenever you are going for the appointment, avoid using any deodorant, any lotion, any perfume or powder, as they can appear as white spots on the X-ray, and that can interfere with the image quality and eventually with the results. Dress comfortably. We recommend, and it's overall recommended, to wear a two-piece outfit. So instead of a dress, since you will need to remove the clothing, the upper clothing, the vest up during the screening, so it is more comfortable for you to wear a two-piece outfit. Now, how does Pink Detect app help you to stay cared for? Pink Detect is all-in-one breast health management app. So if you can see on your screen, once you will enter into the app, it will give you lots of resources. So it's basically an AI-powered risk assessor. It has a personalized self-exam reminders. It has a built-in clinic geolocator, which is a huge part of that. You will see how it helps you. It has a podcast library. It has self-exam simulations. It has resources on breast cancer symptoms. It has some interactive tips for you, and it also has the mammogram guide for you. If you can look at the screen and you can take a moment to scan the QR code and download the app to follow along, that would be great. I can pause for a minute, maybe, or just a few seconds. So if you guys can
we would highly recommend that you download the app today, because it is going to be your constant ally in your breast health management. And we just don't want this session to be restricted to Pinktober. We want you all to have like an all year round ally in monitoring your breast health.
Thank you, Suha.
Of course. I think we can give them until 2 minutes, so essentially until 11:20, and then we can move forward.
Sure.
Yeah. In the meantime, I can also answer a question that we got in the chat, that what are the side effects of chemotherapy and radiation therapy? So they're both very powerful treatments that target your cancer cells, but they can also essentially affect some of your healthy cells, unfortunately, which of course leads to side effects. Now, these side effects can vary from person to person, so it's not like one solution or one side effect for all. So the side effects could be anywhere between fatigue, hair loss, of course, mouth sores, nausea, and vomiting. But of course, they can vary in intensity from person to person. In terms of life expectancy after chemotherapy or radiation, essentially survival after treatment depends on many factors, including what kind of breast cancer do you have, what stage were you diagnosed at, and your treatment response. And everything in that breaks down to early detection. So early detection plays a major role. If your cancer is detected early, especially breast cancer, your survival rates are going to go up. And many patients go on to live very, very long and healthy lives. There's a statistic that in early breast cancer detection, the 5-year survival rate can actually exceed 90%. So just remember that survival isn't just about years, it's also about living well and better prognosis. So yeah, I hope that answers your question.
Perfect. Thank you, Suha. I think it's 20, and I'm hoping that our audience has the access to the app for now.
Yeah, wow, I kept the answer to 2 minutes. I love it.
So I'll just move towards the next slide so that they can look into it. So this is something that they're going to expect from the app right now. If you deep dive, you will see that this is the AI-powered risk assessor, which will be giving you a 10 question. It's a quiz. It's a simple quiz that it will assess as per your health. So it will ask about the physical stats, family history, lifestyle habits, any environmental factors. It is a 10-step questionnaire. And once you complete it, it will generate the results based on your answer, and it will determine the next best steps for you. So it will be a tailored strategy, not a very generic one, and it would be totally based on the answers that you have provided to the app. There is one more, I would say, traction, and I would say a very informative resource that I find in the app is the resource library. So the resource library does have the breast self-exam tutorials, the pictorial guides for symptoms, the audio guides and the podcasts, and also the mammogram manual. Now, if you take a closer look into the resources, you will get to know that those are short audio guides, very easy, which are featuring the healthcare experts. So there is a lot of medical advising going at the back. It's a one-stop shop for all things such as mammogram, giving you all the tutorials, all the things how you can self-exam, and it's also a culturally appropriate depiction of education. So our users are getting more comfortable to the app, and it's more easier for them to use and access each and every single source that is present in the app. Another very amazing feature that I love about the app is the geolocation tooling about the Pink Connect. And this is where you can locate, it connects you to the clinics within a 10 kilometers radius. And it's once a clinic is selected, the clinic details are shown, such as location, what is the time of operation for those clinics, what are the contact infos for them, what are the applicable discounts, if any, present in any of the clinics. And this is a partner healthcare providers, and there are, if any, discounts are prioritized in maps. That is easy for you to go and get checked. There is one more thing, which is a personalized journal, which is, if you dive deep into it, how a journaling features keep women accountable for the breast health. So if you will go more into the app, and if you will see, there is a personalized journal. So this journal will track various aspects of your breast health, and it will provide you a context that why monitoring these factors is crucial for yourself, because it is entirely based on your personal information that you have provided in the questionnaire, and that's how they will elaborate on the self-exam dashboard for you. So if there is any change, any change or any texture change that you notice and you record it in the journal, it will provide you all the necessary steps to be taken forward in a very tailored and a very, I would say, important way for the next steps for you. That brings me to the end of my presentation. But whenever I do end and wrap up my presentation, I do always say one thing, that the human spirit is very strong than anything that can happen to it. So if today our audience take this message and the conversations that we are having and about to have after I'm done with my presentation, is that if we take this spirit home, that change comes with awareness, and awareness is for the Pinktober or for the Pink Detect or for the breast cancer is the early detection, then I think the whole entire webinar and the whole entire message will be more than successful today. And once again, thank you so much. You can follow us on Instagram. There is website and email as well for Suha to reach out for any concerns that you have for now regarding app or any kind of comments. We welcome every suggestions for the app. And that with that, I'll stop sharing my screen and I'll hand it over to Suha. Thank you so much again for bearing with me and listening the voice. I hope it's not too crackling.
Not at all, not at all. It's the flu season. We get it. I just see a bunch of questions, which is good because that means we have engagement. Kudos to everyone who sent in their questions. I'm just going to answer them. No, the app is actually available on Android as well. In the slides, the QR code was just for the iPhone. We apologize for that, but if you just search Ping Detect on Google Play, you should be able to download the app. Yasser Ahmed is asking us, please guide if there is an option for Urdu language, since many Pakistanis might not be able to understand English. So Urdu language for the application is very important. Yes, the Urdu prototype of our app is in the works and it should be out in the market in the next 2 to 3 months. It's just that it's going through some checks, but the Urdu and multilingual support should be available for Ping Detect app very soon, sooner than you know. Sana, there's a question for you since you are really good with mental health, and I think you studied that as well. For the survivors, what are your suggestions for post-trauma therapy and dealing with depression and anxiety?
Sure. So thank you so much for the question. First of all, I do understand that survivors have a lot of trauma post-therapy that they go through, and that adds with depression and anxiety, and also with the fear of, I would say, the recurrence of cancer, which is I think a huge part of that trauma. That, oh, we have gone through the therapy, and is it going to come back? So I think what I have seen so far very much beneficial is that once the survivor is done with their therapy and everything, one should reach out medically for any kind of therapies that are available in your city. And that is if it requires virtual appointments. If the survivor is not comfortable in going in person, then I would suggest doing it maybe virtually. And if there are any groups that for sure will help the breast cancer survivors, those are something where they can share their experiences and they can get a bit more motivated with that. So I think I would suggest those. And if you're asking for the survivor from the perspective of how a family member or the family can help them, is to feel them alive again, make them feel alive again. And for that, what I always suggest is, what people mostly think is to avoid the talks. I would say, please do the talks. And please try to go with them with all of the fears that they have in their minds. Even if it's a successful treatment, they are out of the cancer, but still there are quite a few fears that they want to talk about. And if there are no groups or any medical assistances available that you are not able to find, which I would highly recommend, and there are a few working in there, but yes, as a family member, try to talk those fears out of them, and just try to encourage them, first of all, and congratulate them that they are on such a great journey of recovering and how brave they are. But trust me, with all these post-therapy traumas and depression, they are very real. And I think it gets easier once they are talked, once those, even if you cannot provide the instant solution, but just to listening those traumas which they were going through will help a lot. So I really hope this answers your question. Nabila, thank you.
Awesome. I don't think we have any more questions, so we can quickly move on to our next segment of the workshop, which is basically a small cartoon that we developed initially on how you can perform your self-exams. So it's a small cartoon, not more than 3 minutes, I promise. So it's short and sweet. And with that, I'm going to ask Solmaz to share her screen.
Sorry, guys. Hi, everyone. I have lost my voice. But please enjoy this cartoon.
Hello, and welcome to Pink Detect's breast self-examination tutorial. We understand that talking about breast health can feel uncomfortable and awkward, so your breast health ally is here to help you ensure your breast health in a safe, easy, and private way. Get ready for a fun, lighthearted journey as we guide you through the process of optimizing your breast health. Picture yourself as an artist in front of a mirror, ready to paint a masterpiece on the masterpiece that is your own body. With your arms at your sides, observe your canvas, your breasts, for any changes in size, shape, or contour, and any alterations in the skin, like dimpling, puckering, or redness. Now, raise your arms above your head like you're holding a giant paintbrush. Continue examining your canvas for the same changes in size, shape, contour, and skin. Just like an artist checking for imperfections, look for any signs of fluid discharge from one or both nipples while standing in front of the mirror. Time to get hands-on with your art. Lie down on your back with a pillow under your right shoulder and your right arm behind your head. Using the pads of your 3 middle fingers on your left hand, gently but firmly press in a circular motion around the entire breast and underarm area, like you're tracing the outline of a beautiful flower. You should be checking for any lumps or thickening during your exam. Now, repeat this on your left breast because symmetry is art. Stand up or sit up and give your canvas one last look for any changes you may have missed while lying down. Many women find it easier to examine their breasts when their skin is wet and slippery, so they prefer to do this step in a shower. A perfect place for some watercolor art. Remember to perform a self-breast examination once a month, preferably a few days after your period ends. If you notice any changes or abnormalities, don't panic, but contact your healthcare provider right away. Thank you for joining us for our engaging Paint Detect tutorial. By taking the time to perform regular self-examinations, you're not only protecting your breast health, but also creating a beautiful, healthy masterpiece.
Awesome. I think that is the end of our segment. And with that, we can hand it over to the Zong team for the closing remarks. Or any other thoughts or recommendations for Ping Detect, please drop them in the chat or feel free to voice them. We're more than happy to take any and all kinds of recommendations.
Right. Thank you so much, Suha, Sana, and Solmaz. It was a very informative and very in-depth dive into this pertinent issue that, as you mentioned, Sana, there are a lot of barriers to awareness and barriers to treatment as well. And I would just like to take a minute to commend the efforts that you guys have put into the application, because with the spread of technology and readily available of this information on forums and applications such as yours, it enables people to actually reach a medical professional opinion or information in places where these facilities actually don't exist. There are places in Pakistan where you will get a mobile signal and people do have some form of a smartphone where there are no actual facilities of this quality or this caliber where they can go and consult or even increase their awareness or levels of information. So this actually is a great way to overcome that barrier. So thank you so much. I would also like to encourage all our listeners and viewers, if you have any more questions, you can post them on the chat right now and we can address them. Again, the floor is open to any questions. If anyone would like to pop in and drop a comment or drop a question, they can. All right. Thank you so much, guys. Do you have any final remarks? Do you want to leave our viewers and our listeners with anything, a final thought that would, and we'll probably and hopefully have more sessions with you guys as well, but till then, something to think about or something to act upon?
No, thank you, Ramis, and the entire Zong team for organizing this session. It's very important, like I mentioned in the start. Your audience has been great, very engaging from the start. So we really appreciate that. Usually when it comes to sensitive topics, people are not very engaging and, there's a lot of awkward silences. So I'm glad we did not have that in the session, and we're definitely looking forward to a continued collaboration. My only last ask would be that please, just take one action step with you for your families, either for yourself or for your communities, to create a lasting change so that we can reduce the numbers and we can make the statistics better for Pakistan, and have like better prognosis for people who have breast cancer or will be diagnosed in the future. We just want early detection to be a norm and for the breast cancer mortality to reduce significantly. And one last ask would be, if you guys are on Instagram, please give us a follow, check out our website. And like I mentioned, we're always open to suggestions. Feel free to contact me or my team if you think there's some of the improvements that we could talk about or any other aspects that you want us to talk about in our future presentations. With that, I think we can happily sign off and let you guys go and enjoy the rest of your day.
Thank you so much, Suha. Thank you so much, and thank you, Sana. And thank you to everyone who joined us today. At Zong, we're really proud to stand with initiatives and facilities such as yours, and also blend innovation with that factor of health awareness and compassion, using technology not just to connect people, but also to increase awareness, to increase care for them, and also to reduce the stigma around issues such as this. So this was great. I really hope everyone who was listening enjoyed and learned something today. Thank you so much for your time, guys. Stay healthy, stay aware, and I hope that we continue to inspire change within us and with people around us. So thank you so much, guys. With that, I'll sign off. Thank you for joining us, and stay tuned for many more activities and sessions such as this, guys.
Thank you so much. Have a great day.
Bye-bye.